To an expert testifying in the Michael Jackson trial, the king of pop is the only human to ever go 2 full months without sleep, REM sleep, REM sleep, which doctors say is a vital part of our sleep pattern.
Yeah, this is why in today's Doc Hollywood, we're sitting down with a sleep medicine doctor to find out how he did it and why sleep is so important to keeping us healthy. Hey everybody, I'm back with Dr. Charlene McEvoy, and she is a sleep medicine doctor at Regents Hospital. Nice to see you again, Dr. McEvoy.
Nice to see you.
So we're going to start with James Gandolfini. And James Gandolfini, of course, a big story. Top Hollywood actor, passed away unexpectedly of a heart attack while he was in Italy. And it's been suggested that he may have suffered with insomnia and possibly even sleep apnea. And James Gandolfini was overweight. Can you talk a little bit about what sleep apnea is and how that might potentially contribute to a heart attack?
Sleep apnea, or more specifically obstructive sleep apnea, is a disorder where people's airways sort of collapse while they're sleeping at night, so it obstructs getting the air in and interrupts the sleep throughout the night. And when those interruptions occur, you know, your oxygen drops, and then your heart rate will go up, your blood pressure can go up, and then we know that all these little substances in our blood that cause more inflammation in the body are released. That leads to a lot of the damage to our blood vessels in our heart. Sleep apnea is associated with obesity, but you can see it even in thin people.
We'll move on and talk a little bit about Michael Jackson, and an expert trial witness is talking about Michael Jackson, saying that he may be the only human to have ever gone 2 full months without REM, or random eye movement sleep. He said that he gave Jackson 60 nights of propofol infusions, which is normally reserved for surgery, and that drug will leave a patient feeling refreshed and awake, even though they were deprived of that REM sleep, which is vital to the brain and the body. So you got to explain to us what's going on here.
The more we deprive people of REM, which we think is a very important part of sleep, about 20% of the night, the more we're going to see problems with anxiety, confusion, memory problems, depression. We know it is not a good thing.
What's happening to us when we're in that REM stage?
There's a lot we don't know about sleep, especially even REM sleep. We believe it's when we have our dreams. We also know that when we're in REM sleep, our muscle tone goes down, diminishes dramatically, so that almost is like we're paralyzed. We know that our heart rate becomes more erratic. We know that our brain waves look like we're almost awake. We know that our body temperature drops and then starts rising. So we think it's a time that a lot of things get sort of retooled, as well as our deep phases of sleep, but there's a lot that's going on in REM that is confusing to the researchers.
So let's talk about sleepwalking. Jennifer Aniston rumored to have repeated incidents of this. How does this happen?
It's during our deep sleep, our delta deep sleep, and it's usually at the beginning of the night. Usually they last from anywhere from 30 seconds to 30 minutes, so they're long periods of time. It can be dangerous if they could walk out the door into a cold night.
And we've heard of some sleep aids warnings that say that you might even drive and not remember. How does that happen?
That's correct. And we see it with several of the sleep aids, that people will use them because they're sleep deprived, and so you add sleep aid on top of significant sleep deprivation, then they have a propensity to be a sleepwalker. They may drive, they can, all sorts of things can happen.
So if you're going to take those, you really have to have somebody monitoring you?
You should, definitely should. And I wouldn't prescribe to someone who has a history of sleepwalking or behaviors during their sleep.
Well, thank you so much, Dr. McEvoy. Sleep well tonight, okay?
I will.
And thanks so much to Regents Hospital and Health Partners Clinics for sponsoring the show. And remember to check with your physician if you have any kind of health concern.